Well, hey gang, how's it going? So we're working on our little cuts, the Jack Welch theory of cutting the bottom 10% we perceive, giving it to the top 20, using the university as an example. And since some of you have come up with a bright idea of cutting things that might affect students, I felt it would be great to have Jamie Nixon. Now, Jamie, we did make a mistake, both of us. You made the mistake first. You called me Dr. Kirby. I don't know everything, so I don't have a PhD, right? And I called her Dr. Nixon. She was like, I'm a PA. So it's great, but kind of introduce yourself and, you have the floor.
Okay, so Jamie Nixon, I'm a PA, and I'm medical director here at St. Mark's. I've worked here for over 12 years in this role. I'm part-time, so I'm Monday, Wednesday, Friday at the clinic, and I serve in both the role of administrator and clinician. I'm a primary care provider by training, and I have been working over 12 plus years in this role and at a West Side primary care clinic, which has been acquired by multi-care. So I'm a multi-care family practice provider. I have a patient panel that's over 900 patients. The full-time provider carries 1,200, so I don't know how that happened to me. But so I am trained, prescribed, I do procedures, I do all of the things. Here on campus, if you have health services needs, you have paid through your tuition a fee. It's a student health and wellness and safety fee. So if you've ever looked at your breakdown, you have your tuition and then you have additional fees. There's the campus activity fee, there's a bunch, but $290 per semester is a subset that goes to me and the health center, to public safety for additional safety officers on campus, as well as the counseling center's timely care plan, which is the 24-hour access to counselors.
So the first question we would have is, how often do you think kids would go to any kind of student wellness if they didn't have the coverage automatic within their tuition?
I'm always amazed at who doesn't know what we do. I think there's this sort of carryover from adolescence thinking that we're just like a school nurse, so you would just come for Band-Aids. And then there is the additional post-pandemic health-focused fatigue, where I unfortunately had to treat all of the students as vectors, and it sort of created an unnecessary divide between me and the direct patient care that I wanted to do for those years. That was a challenge, right? So if you know that you've paid for something, does that make you want to use it more? I don't know, when I looked at my property tax breakdown, I was like, oh, I paid for the library. I can only use the libraries. I'm not going to go buy books anymore. So,
but do you think that they would actually, if they hurt themselves, they would actually go see somebody? Or do you think they would probably let it exacerbate because they didn't want to spend the money?
If they paid for it,
let's say it wasn't there.
To use it.
Yeah, let's say it wasn't there.
If it wasn't there, would they still
we just went. Would they go to the doctor, or do you think they would probably let it get worse?
They would most likely have to use off-campus resources. And I don't know if any of you have off-campus providers or have tried to go to an urgent care or go to an emergency room lately. You are going to sit and you are going to wait at least 4 hours. And that's just bare minimum. Right? Plus, you're going to have any out-of-pocket expenses. All of you have a different health insurance plan, either through a parent if you're under 26, most likely, or you're on the student health plan, or you're on state Medicaid. Like, there's tons of them, and all of that's going to impact your ability to access care off campus. So if we weren't here, you were going to have to need to find the closest urgent care that accepts your insurance so that you're not going to be paying a premium for out-of-network services. How many of you know what insurance plan you carry? And how many of you know what that coverage looks like for care? Like, do you know if you're an 80-20 deductible? Do you know if you have what your out-of-pocket maximum is? Do you know your co-insurance? All of these things.
Do you know your co-pays?
Do you know your co-pays? Yeah, like, do you know if you have what your in-network preferred hospital provider is? Like, do you have to go to Providence? Do you have to go to Multicare? Do you have to go to Madigan? Do you have to go to... it's numerous. And right now, the average wait time to get into a primary care provider in this community is 4 months.
So then also tell us what would happen with mental health services if we didn't have those services here on campus.
So this is something that is very close to my heart. I've been in this role for 12 years, and I've seen 5 directors of counseling and wellness services come and go in that duration. But each of them was phenomenal. They built wonderful relationships, lasting relationships with their clients, and they serve as a touch point when students are in emotional crisis. Right now, we do not have great psychiatric community care. If you are going to be needing to be admitted, there is this drawn-out process that involves the emergency room and crisis counselors that have to assess, and then there's finding a bed somewhere in the state if a student needs to be admitted for suicidal ideation, for suicidal attempt, for addiction services, you name that. We offer all of those pre-intervention strategies to help students not reach those crises points. And in my 12 years here, I have worked closely with the counseling center to be able to prescribe medications for students if they are such as SSRIs, selective like Prozac or Zoloft or Wellbutrin or something like that. Students need a temporary medication to help them bridge through whatever crises that they're going through. So we have not had, and I'm I don't want to say these things out loud, but we haven't had an on-campus suicide in my 12 years here.
But do we believe that maybe suicide ideation and all those problems might jump up if we didn't have those abilities to talk to those people?
Absolutely.
Yeah. So that's part of the drasticness is that if you cut stuff, there's something that's to be said about that. What about Saints Care?
Saints Care is an intervention strategy where for so long faculty or staff that have relationships with students that would then they would be like, hey, so-and-so's not coming to class anymore, or so-and-so seems like their grades are dipping, or they're drastically losing weight, or there's some sort of something is off with this student and they wouldn't know where to go. And if they would come to me, I would say, well, for HIPAA, this student is an adult. They have to choose to come to me. I can't just call them and be like, come see me. With Saints Care, we can require that you are seen by the psychologists on campus and evaluated for assessment. It is a really great way of empowering faculty and staff and friends and RAs to basically say, I'm worried about this person and I don't feel like I have the skills to intercede or just to be able to service what they're currently lacking. Yeah.
So kind of like facilities. You guys are kind of the unseen, right? It's like IT, right? Facilities, IT, you guys, it's something that people may not see, but it helps everything.
So the paradox of public health and health in general is the more, what's the phrasing, the more effective we are, the less necessary we seem.
Yes.
So the disease prevention, the strategies, the immunization protocols, all of those things, that it's a state law, the public health department requires that we make sure all students living in residence halls are vaccinated against meningitis. What would happen if you weren't? What if there wasn't an office that's required to mandate that and there was a meningitis outbreak?
What happened what happened about, was it 10, 15 years ago in college campuses with meningococcal meningitis? There were kids that were getting it, and then they were dropping like flies, right? I mean, there was
not on our campus, but
not on our campus, but in general,
there were meningitis outbreaks at colleges. There's Oregon had one, so they actually require an additional meningitis vaccine. It's called Men B. We recommend, but we don't require it until the CDC and ACHIP, the American College of Pediatrics, that they recommended that we can require it. Once but the Men B is on the rise. So,
and then, just kind of going back to, let's say we cut some of this stuff. I'm sure Mama Bird's going to be okay with Baby Bird getting hurt and we didn't provide certain services, right?
Goodness, yes.
Because Mama Bird never gets involved, right?
I get calls from parents, and that's when I love HIPAA. I absolutely love HIPAA. Because we have a form when you're seen at the health center that basically says, you can tell my mom anything. You can tell, and then there's a breakout where it's like, you can tell my mom anything except if I'm tested for STIs or about drugs and alcohol. Like, don't talk to her about those things. But you can tell her about my strap, you can tell her about my, sprained ankle, whatever. And so we are really clear, and that form expires every 6 months in case you have a change in relationship with that parent. That's happened. Those dynamics shift, unfortunately. But yeah, I could be like, well, talk to your student.
Yeah, so if we all of a sudden just had this cut, we decided that she was no longer necessary, I'm sure Mama Bird would be okay with that. Just saying, hey, we just rewarded the top 20%. We just took that funds. That would just go over well, don't you think?
It's an interesting model to look at because PLU just did this with their health services. So if you wanted to do some comparatives, you can look at my counterparts in the region to see and find out what students are saying. Find out if students are enjoying this off-campus access only to Indigo urgent cares with minimal access to provider. You have access to a clinician 5 days a week. Myself, and we have 2 male PAs on a Tuesday and Thursday as well.
So I realized that some of you went, okay, GE, General Electric, 400,000 people, they did this for 25 years. Boy, that's some business. This got drastically taken to the next level where everybody tries to copy it, and there are very mixed results. And so this is why we use something you care about rather than something maybe you don't even care if the lights are on.
Well, it's an interesting question too because we were essential 4 years ago, and now we're in that model of thinking about budget cuts in general. Are we expendable? Are we trying to outsource the services that we provide so that is that? But what does that look like? What would the campus have been like 4 years ago if we weren't here?
I was going to ask, you mentioned timely care as a 24/7 hotline, I guess, basically. Yeah. So what's the difference between that and like Saints Care?
So timely care is a one-on-one counseling service that the student initiates themselves to be in counseling. Saints Care is somebody's like, I'm worried about this student. Then the school reaches out to that student and says, we want you to see a counselor, we want you to go to the health center, we want you to go to so-and-so or wherever to get that care. So it's where the referral comes from. Is it self-initiated or is it outside required? And
you mentioned that you like Saints Care because if it wasn't in place, then there would be like a HIPAA thing?
Well, so if a student is suicidal, they're not going to be only suicidal between the window of 9 to 5 when the counseling center is open.
Right.
That is where having that additional access at 4 a.m. for somebody to be able to call and say, I need to talk to somebody.
Yeah, so imagine that. Just go to the emergency room. Yeah, so you get to sit around for 5-6 hours. I'm sure that's not as wonderful as you want to think, right?
Well, I mean, it is oftentimes a reset for people to be like, my life is great. Like looking around the ER. I'm joking, but it does, it is important to have that kind of reset of looking at seeing how much worse it can be.
So this is a kind of a private medical thing for the school, correct? Nobody else can come here. So that is exclusive to Saints to come in and receive help because that 5-hour block is pain because I did go to Providence and they have 2 rooms to be checked and you are waiting there, but you have the exclusivity of being, hey, I need this, and it does take that time, lessen the time and make it more personal too. Yeah. It is the safe space for you guys.
And what is your time frame?
Yeah, great. Anything else that you'd like to add to this little experiment?
No.
How would that make you feel to feel that you're not part of the bottom 10%, but you're part of the 70% that doesn't get rewarded? You're just kind of there. Like the top 20% gets rewarded, the top 10%, or the bottom 10% gets cut. But how would that make you feel?
So it's an interesting question because I do have another job, and that psychologically for me is like, well, I'll just go there full time. But then I worry about the students. I worry about what will happen on campus. Like, will they hire an NP that, is, I've heard other college health centers have more unapproachable or more inaccessible, or just ones like if you look at the Puget Sound model, they're like, they hit you with all sorts of fees. And I've been really protective of basically being like, no, there's no charge, unlimited visits, come in. We don't charge you for the flu test. We don't charge you for pregnancy tests. We don't charge you to screen for UTIs. We can do that all that in-house, and all of that comes out of our budget. Everything is covered. You know, we give away so many supplies, and if you're sick, we've got goodie bags that have lozenges and ibuprofen and thermometers. Like, we really make sure that we spend more money intentionally, but at Puget Sound, they'll be like, well, we'll charge you for these labs that we're going to do up to $100, and then outside of that, we'll just bill your insurance. Well, I'm like, just bill your insurance because it'll cover it. So we don't bill the insurance, the lab does. Like, if you come in for a blood draw, cholesterol screening, STI screening, whatever.
So notice what Jamie talked about a little bit. I can go to the other job, not that you want to, but Phil Chief talked about the tune-out factor. Imagine being part of the group that's just kind of tuned out. So look what happens, right? You're not part of the all-stars, quote unquote. Now all of a sudden it changes your perception, maybe on the university, it changes your perception on whether or not.
We can talk about burnout, but provider burnout, if they did a survey at Multicare of all of the providers, right? Recently, 85% of them have contemplated leaving within the next 5 years. So if you think about that part of, like, we don't feel, as clinicians, we don't feel seen, we don't feel valued, we feel overworked, we feel under-supported. And I can point back to during the pandemic where I was drowning in labs, drowning in immunization records, drowning in all sorts of things. I developed a corneal abrasion on my eye from so much screen time. And then just not having the wherewithal to be able to say, I need help. Finally I was able to say, like, I need to outsource some of these things and to be all of this work.
So fall semester, we had Darren Gross, who is the CEO of Providence, come in.
Yeah.
And he not only talked about that, but he also talked about all of the kind of the dropout. Like, there's just this, like, it's just people gone, right?
Yeah.
And there's nothing, we don't know how to make it work,
Do people want to go into healthcare knowing
Yes.
what it's going to be like?
Yeah. Not so much.
No, it's really.
So imagine that we institute this at this university. We're really going to recruit the best and brightest after that point, Also, not even with staff, with students.
Yeah.
You think students are going to more want to come here after that? It's kind of interesting.
But this just, honestly, like, how many of you think about your healthcare on a regular? You're young, you're healthy. It's something that is just sort of back of your mind until you need it. That is the only point that you're actually going to consider.
Until baby bird gets hurt, right?
Yeah.
Well, Jamie, anything else?
Do any of you have any questions? Like, how many of you even knew you had access to full services healthcare?
Do I actually still have access?
Are you grad? Yeah, of course you do.
There you go.
That's it. No, because I know that I have to go in there and, like, hey, I have insurance.
Yeah.
Good. All right, because I was like, man, I need a flu shot.
Yeah, all of you get a free flu shot every fall.
See, there you go.
We get 300, and we actually, one year we didn't use all 300. But
You ever try to go to Walgreens or Safeway? See how long that takes? Not necessarily the easiest.
Yes.
Go ahead and make one.
Yeah. Like I said, you can use our services. We can collaborate with your off-campus provider. We help refill medications that other providers have started just while you're here on campus. And we don't accept insurance. So the only reason that we would ever ask for your insurance card is if we're doing outside labs or if we're going to be doing a referral for imaging or referral to outside providers or specialists. So there's a difference. So, like, with your question, was it, did you want to cut the health center or did you want to cut the insurance plan?
Yeah, 1%, by the way, because it's 10%, 1% equals a person.
1%.
So you're gonna, how much are you gonna cut from that group? Yeah.
I was just thinking,
5%.
my initial plan was going to be like, just cut like part of 1% and as Saints Care and then once I found out about timely care too, and correct me if I'm wrong, but like I don't know, you could just kind of make timely care more widely known as like a counseling wellness hotline. But then, I found out that all the Saints Care people, there's not really anybody that like works just Saints Care.
Yeah.
It's all kind of connected. So even if
Isn't
you
it
cut back,
amazing?
like as far as like budget cuts, that wouldn't even really do anything.
Isn't it amazing when you actually have to research?
Yeah.
You actually have to look and see how many, because it seems like there's a lot of staff in there. And then when you find out there's really not.
It's just like 5 people.
Yeah, it's like,
12 hats,
Yeah.
basically.
Yeah. And do you have any questions? You want to cut the student health plan? You were so adamant about cutting the student health plan. You mentioned this over and over again. No. 4 classes worth. I had to listen to this.
Oh, okay.
Student health plan. How are we going to cut it?
Yeah. First thing, I just got one question for you about I want to ask how long we have to wait for making appointment with a doctor when we need a service, like when
Same
we
day walk-in.
just walk in.
Same day walk-in.
Like, do you think we gonna take really a long time to waiting or something? Because I did hear from my friend from another university. They said they have to wait really long time, for a week to get to meeting an appointment with the doctor when they heard the stomach.
That's horrible to hear. Yeah, honestly, I'm sad that our male providers are underutilized on Tuesdays and Thursdays. Last Thursday, Kwame was there and he didn't see a single student.
Okay,
So, budget cuts, do we even need to have a Thursday provider if nobody's going to be utilizing the services?
This is one of the big things I'm thinking, because I'm thinking maybe the San Martin University is the same with the other university doing with the air insurance, but I feel I'm wrong. Yeah. Man, everyone.
Yeah, but it feels different when all of a sudden you have to. And by the way, here's the other thing. Why don't you look her in the eye and lay her off?
That's why.
It's a little bit more difficult when you actually have to tell people that they are not right. Because what's the big thing that Google and all of them have been doing? These Zoom calls.
Yeah.
Imagine just getting your life shoved down the toilet because somebody just decides they don't even have to look at you. A little hard, right? Could you look at her and lay her off right now? You just cut her program. A little bit more difficult, right?
And I have the 5 staff under me too.
Yeah, and I'm sure they would love to walk in here while you tell them that they are non-essential anymore. That's part of the reason that we go through this is because at some point somebody's going to put a book in front of you that's going to have all of the budgets or an Excel spreadsheet and say, hey, we need to cut some stuff at some organization. And you're going to have to go, oh my God, I can't just cut somebody and just annihilate their life. So you're going to actually have to be studious to it. I know it's difficult because, you two brought this up.
Multicare had over $160 million budget shortfalls post-pandemic when a lot of the federal funding came through. And they did a lot of admin cuts. And from a provider stance, it was that's great, but now who do we go to? There's so much with this corporatization, because my clinic, I've been bought and sold 5 times. It was an independent clinic sold to Capital Medical Center, and a lot of behind-the-scenes acquisitions and remote ownership. Hospital Corporations of America.
You heard the word synergy too many times.
Jeez. Yeah, and just sort of seeing how, it took me 4 months to get a laptop charger. 4 months. And emailing IT, and then I'd be well, you put the laptop here, and it's got my cast to my monitors, but I don't have a charger to take it home with me so that I can work on the weekends, because of course that's required. And they were we lost it. Nobody ever gave me one. And just the back and forth and non-response. And when there is that higher level of corporatization, there is less ownership. There's less accountability.
The other problem is that the people that go into these fields typically have no interest in healthcare. They see the money. They see a $260,000 a year job, which sounds awesome, and then they just need to cut. They don't care. It's pure hospitalization, not theirs, right? That's what Darren talks about, because he worked at the Mayo Clinic for 21 years before. Then he noticed that a lot of people had no inkling towards hospitalization or healthcare. It was just, hey, I got a great job.
And just when they talk about provider productivity and bottom line, like it's not me sitting and interacting with the student and getting to know you on a personal level, asking about your majors, your interests, your homes, your sports, all of those types of things because I'm nosy, but also because I'm genuinely interested. And then at my other job, I have 20 minutes to go over a med list that might be 20 meds long, an allergy list, and then reviewing outside lab results and clinician notes. And it's basically like see more patients.
And isn't it fun that we use the term that is basically active in World War I triage? And we said, we need this for the emergency room. How can we see as many patients as possible and not really help them as if we have bullets flying?
And then just general patient awareness of like what is actually an appropriate use of the emergency room.
Yeah.
But the lack of those primary care providers or urgent care accessibility, that's going to lead to more ER services.
Okay.
Unfortunately, but the struggle that multi-care is in is their payer mix has shifted. Did Darren talk about that? So basically, when you used to see state employees that carry an insurance that reimburses 80 cents on the dollar versus Medicaid that reimburses 25 cents on the dollar.
And then the other issue with insurance, they play the float. If you ever go to a chiropractor and they always just want $25, $45 from you rather than insurance, it's because they have to wait 6 to 9 months to get paid. So imagine how long that takes, and imagine what that does to you if you can't get the money up front.
And like outside clinicians, like for psychologists or social workers for mental health, a lot of them aren't even accepting insurance because of that hassle. So there's just $60 a session, $80 a session, and pushing it all onto the consumer.
Any other questions? Okay. Well, Jamie, thank you very much.
You're welcome.
Appreciate it. Oh my gosh, she was so amazing, wasn't she?
Yep.
So what are we going to do today? We're going to talk about hiring process, or we're going to talk about redundancies? It's other people's jobs. Anybody know what a redundancy is? Madison, what's a redundancy?
You kind of say the same thing over and over, maybe differently phrased, but the same thing.
So you two do the same thing. Should I just cut one of you? I mean, you do the same thing. You both get educated. So, I mean, if I cut one of you, is that okay? Oh, but you're going to hear this over and over again, redundancies. So what are we going to do in terms of redundancies? How are we going to detect redundancies within our cutting model? Andrew, what are we going to do to find out what exactly you do here? She's got 5 people underneath her. You want to cut, you want to slash and burn some stuff. So did men. Oh my gosh, men. This has just been the men show. I'm excited. Yu's like, I'm glad I did not suggest anything.
That's what I'm thinking right now.
Here's what I'm thinking right now. Okay, I'm excited.
Okay, so asking me, what's the question you want to ask?
Well, what are we going to cut? Come on, your entire plan has been put up. Facilities. I mean, what else do you want to cut? I'm getting the music department now.
Oh yeah.
Yes, please.
Oh,
Yeah.
yes.
Yeah, another guy in the back.
They're gonna sing some songs. No, what are we gonna cut?
So that I'm thinking like about instead like we cut like because after watching like 2 guest speakers speaking, I do see like about cutting people is not the best way to gotta cut like because when we need them when we need them because you just cut them so we don't have them we have to hire other people. That means we do cost more than money. So yeah, because we cost like for training or something else, that's something like you worry. So instead that I'm thinking like something like about like a light, something like that, and then we switching to the LED light.
Like the honor society that doesn't actually factor in $1. Doesn't actually. I checked it out today. Yeah. So if you want to cut that, go right ahead. But that means no cuts. Sorry.
Yeah,
I wanted to do that. I've been waiting. I actually investigated. I got my email back.
Yeah, I mean,
Taking Amy down.
I will. Y'all do respect everyone. I don't want to cut anyone.
Wait, suddenly we don't want to cut everybody. It was
Like,
Madison couldn't go to the. She could say wait for 6 hours because you're going to cut her health insurance. By the way, does anybody know what health insurance actually costs?
$1,000 divided by or foreman will be.
No. That's what you think it costs.
Oh,
What does it cost on the open market, AJ? Oh, I don't know, about $180 a month. That's what I have to pay. I'm excited to see what Min's going to have you pay for as a student. You excited about that? Not just $290 in your tuition.
Oh, sorry, Jonathan.
Yeah.
That's what.
Madison's got a broken arm.
Yeah.
She's going to let that exacerbate.
Okay, so just ignore him. You know what? 4 times I know that I have to do this.
Okay. What are we going to cut? Now that you've heard all this stuff, I'm excited. One of the Connors is like, I can't even figure this out. The other one can't even figure out Moodle. It's good. 6 a.m. on a Saturday. What the hell?
No, it's 9 p.m.
9 p.m.
I don't know.
Did you like my response?
I did. I like the last one.
Yeah.
Oh, yeah, you again when I'm eating.
Okay.
I don't know, like after hearing what she had to say, like how he had like, I don't know if he has like too many employees or not enough.
Not enough. By the way, how about the fact that you guys just found a way to defend your baseball program on Friday? Because what happens if we cut the fields and we just decide not to cut them for a while? We just decide not to maintain them. It costs us $100,000 when we want to do it again.
Yeah.
I think you just found your little excuse for what you do, right? It's kind of a little hard to take that in the shorts, isn't it?
Yeah.
Like, because all of a sudden, Tyler, what are we going to do now? What's our cuts going to look like now? We're looking at redundancies. What's a redundancy we're going to find in the system? How are we going to examine redundancies?
Just about finding out like what everyone does.
You're going to find out what everyone does. You believe they're going to tell you when they're doing redundant behavior? Okay, so you're going to talk to everybody. So, great. What does that mean? What does that mean? You had Phil Cheek in here who told you that everybody was essential. You just had Jamie tell you everybody was essential. Are you sure about that? No?
It's just going off of their word.
Going off of their word. What's the fallacy that might exist in trying to determine a redundancy, Austin?
I don't know.
You don't know? You worked in the U.S. military. Military intelligence, the stupidest thing that's ever been said.
That is pretty dumb.
Along with, we're from the government and we're here to help. Okay, so what do you think might be a fallacy in that system?
I'm having a tough time.
How about the fact that they might just tell you what you want to hear to get you to go away? Yes, me? Do we feel that there are redundancies in every system? Sure. And then how are we going to find them? Looking at the fine print? Yes.
Well, I just noticed that when Jamie was talking, she said that she's there Monday, Wednesday, Friday, and on Thursday, sometimes the person who's there doesn't even actually see anyone. So not necessarily that he should get cut or that day we just don't have anybody.
Use the term
she
should
said
no.
she said that she has 5 people underneath her. What are they doing?
Oh my God, we might actually have to examine their job duties. Alexander, how are we going to examine job duties? How are we going to make sure that we know they're actually doing what they say they're doing?
I guess you kind of have to be with them throughout their day-to-day.
So we just can't take their word for it?
You have to actually see it for yourself.
Okay, so, do you everyone know why they call him Peter the Great? Ran Russia, basically created an empire. It's because when he bought boats down at the shipyards in Britain, he totally scared the shit out of Catherine. Catherine the Great, she's great. Well, why do you want to go down to the shipyards yourself? He went down and learned how to build them so he could teach his folks back home how to do it. Does that maybe mean that we're eliminating some of the process? Maybe we're eliminating some of the idea that other people control what we do, so we actually have to get our hands dirty. Madison, what would happen if we didn't get our hands dirty and learn what student help did? Maybe we would turn into men?
Actually, cut stuff that we didn't even know was important or failed to see that something that's essential was under an umbrella that we didn't think was essential.
Okay, men, we're going to go back to your thing as Alexander and Connor keep talking in the back and don't think I have good side eye. Men, so let's say we cut this thing based off of your recommendation. We cut the student wellness, right?
Oh yeah, but
No, but let's say we do it, and then we have a student here, X.
student B.
Yeah, student B, whatever. Now that person tries to go to the emergency room, can't. She's having some mental issues. Keeps going 5 hours. Nobody wants to sit there. And then she hurts herself. Himself. I don't care, right? How do you feel? You're the administrator. You're the one that made those cuts.
Yeah. So I
No, and by the way, let's pretend that we're going the Wayback Machine an hour ago before you even talked to Jamie. How do you feel now?
How do I feel now? I feel like I mean,
Because you didn't
not my
investigate.
fault. I feel like this is my fault.
No, but because you didn't investigate it, right?
Yeah.
Because we didn't talk about it. We didn't know what happened. I mean, it's great to talk about baseball fields and crap like that. Come on. Nobody's dying, right? But if you're actually affecting people's health and wellness, you help cause that. I mean, that's got to be a huge weight on your shoulders, doesn't it?
Yeah.
Alexander, how do you feel about that? How would you feel if you decide to make a cut and it in the organization and that person had some issues afterwards?
It kind of puts the pressure on you, like it's your fault because you didn't do the investigation that you needed to.
Yeah.
To what you were cutting, you ended up cutting something that's necessary. You had no idea about.
Anybody see that movie Up in the Air with George Clooney? Basically a professional that comes in and just has to lay people off. They always make it so clinical. They always make it so stuff, and then one of them hurts themselves, and the girl just decides she can't take it. It's a lot of weight on your shoulders. I mean, they were contracted out to go do that. But as I mentioned, she was standing here. I noticed none of you took the gun to go and lay her off. A little harder, right? Andrew, could you have done it? Could you have said, I'm sorry, you're no longer needed here? No, I mean, being
honestly,
honest.
in that situation, I'd probably, and this is, of course, the fact that she has another job already, she probably wouldn't have been insanely upset about it, done anything drastic. Like, I mean, she was even talking about if she was in the middle 70%, whatever, she probably would be thinking about.
But notice,
Just going out.
notice what she was thinking about.
Yeah,
Who was she thinking about?
the students.
Yeah. So is laying her off? Is that affecting you guys, the customer? Or who's the customer? Freddie, who's the customer?
We are.
You are. So how does that affect you?
I mean, we're paying for something.
No, you're no longer paying mint cut.
What?
You saved your $600. You saved your $600 a year. You saved your $600 a year. Your $44,000 went down to $43,300.
Hey, you always put me on the spot.
Yes, I do. But I want you to think about that. How does that make you feel knowing you made a cut? He made a cut. How does that make you feel knowing that a person that cared enough about you and your health or your wellness, or maybe you're not showing up, or maybe you have some issues that are going on? Now you get to wait in the emergency room. PLU. Was it Puget Sound? PLU. You guys really think you want to take that Pepsi challenge and go to that school now that you heard that? It has nothing to do with the academics. Look at the cause and effect. Jane, do you think that would be something you'd want to do? You don't know?
No, I said no.
No. And by the way, there's no right or wrong answer. Go
Well,
for
and
it.
I was just thinking about, since I know that, it's not even so much of a, because I personally haven't used any, besides like maybe a COVID test or something, but I haven't really used the health center or counseling, wellness, anything like that. But just sort of looking at it from, do I want to apply there if they don't even care enough about their students to have, kind of like medical help, should you need it?
They care about their students. Look, I can give you a PR speech about how somebody cares about blah, blah, blah.
Yeah.
I can give you PR. Then Baby Bird, right, gets hurt.
Yeah.
Sorry, I keep looking at you. But you know what I mean? Like, it's like all of a sudden, Mama's not going to put up with that issue. Right? Yes.
I want to say, like, with Andrew's idea, I think they care because the way that like she talked about the student wellness center. I think they care about the student. That's why they create this office. They don't create it for like just be there and stand there. First I'm thinking like because I'm cutting the student don't need that. But the problem is like I don't think it's like yeah, what if like if I cut them some people they need that and they just accidentally and I do remember the story that my cousin talked about the guy who killed himself by burning himself in the middle of the school because like he stressed out on learning and I'm thinking like that's why we need to have the student wellness center in the school. That's why I removed it literally in my essay.
Oh,
Okay.
oh! All of a sudden you get called out, and I'm going to remove it. So then, what are you going to cut now? You still got to cut a bottom 10%. Are you going to join Alexander and Connor, who want to cut the music program?
No.
I'm sure that will have no effects. I'm drastically sure that there will be no effects of any student that uses that program that will then decide that that's not a good thing, right? There's going to be a cause and effect. So what are you going to cut now?
You're saying we can cut everything.
You can cut everything.
Everything.
You want to cut me?
I don't
Oh!
I don't want you to keep me
That's exciting. By the way, how many people know that 45% of your classes are taught by adjuncts? I'm not even an adjunct, but I was. But so we're gonna cut back on the amount of classes that you offer. If you're 45% are taught by people that only get paid $3,000 a semester. Do you really think you're going to save that much? You're only going to save $646,000. I did the math.
So that's a lot.
That's a lot. But what's going to happen to the students?
Yeah.
Are you going to feel that your education is more or less valuable, Austin? I mean, I know that I blew your mind in marketing class last spring, and Yasmin just keeps talking about it. But at the same time, I mean, doesn't that seem like we're cutting off our nose to spite our face? Everyone knows what that's about. Everyone knows where that term comes from. Yasmin? You don't know where that term comes from? The Goths surrounded a convent. They were going to go attack them, pillage, do the horrible things. And the nuns decided to cut off their nose in order to make themselves look ghastly. And they kept their virtue. Now they lost their nose, but, what does that tell you? That tells you some people are willing to go to extremes, isn't it? Alexander, so now that we're still cutting music?
Oh yeah.
Oh yeah. I don't know. Where did the music department hurt you? I don't know.
I think it kind of started as like a little joke. It's like, oh, music. And I was like, you know what? There's some logic behind it.
Okay.
Yeah.
So now I got to find out the music professor. Go for it.
As someone who suffered through fire for 3 years, he thinks it's going to be a minor impact. Don't worry about it. It's not going to start forward.
I think. Hold on. Do you think I should bring in Kathleen McKinney? She's right down the hall from me. She sees me all the time. I wonder if she would come in. She teaches French, because another thing that everyone loves to beat up is, we don't know foreign language. Yeah, that would be great. So we'd have no foreign language because I'm sure all of you would go out and buy the Rosetta Stone.
I have it.
If there's one thing that this class or any class does for you, it's hold you accountable to things you otherwise wouldn't do. If you want to see the difference, go look at how you scramble at the end for online classes to do all this stuff. I have some kids that sit in class and don't actually do anything and then still have problems. But, I mean, can you imagine online? I'll just learn. I'll learn later. Yeah, how's that going to work? Okay, so what are we going to cut, AJ? We got any differences than what we had before? Or we're just going to cut everything? Slash and burn?
I don't know. But that's more like I wrote my thing of like what I want to reward more about this graphical cutting.
Okay. So what are we rewarding?
Well,
aside from Honor Society, which is going to get really
like
kicked down the hole.
facilities, he talked about how he would like to have more. And it's kind of like I wrote like how it's the facilities department that will help make this campus look more better to the eye, and that will attract more students because no one wants to go to a campus that looks like a piece of crap.
Okay, so let's say we've cut student health, cut that stuff, and we've given it to facilities. No, hold on.
Oh yeah, wait.
What's the perception? What's the perception change? Oh, we have a beautiful campus.
So we don't care about the students now.
Everything comes back to, right? No matter what you do. And also, what happens to the facilities guys compared to the doctors or the PAs or any of those people? What's the perception there? You don't think there's a change?
Oh,
You don't think there's a way that suddenly the facilities guys are like, we like this extra money. Suddenly they're cut more, right?
Yeah.
Because they're benefited. Doesn't that turn them into like the worst versions of people that you possibly have?
Yeah.
Oh my gosh.